I'm Nick Harrington, EMRupdate.com. Here at EMR Update, we really do celebrate our Casual Fridays. Well, thanks to Robert Gleeman and Mark Anderson, you really get to see what our reporters and interviewees really like to wear heading into the weekend. In this Casual Friday interview, Bob and Mark talk about EMR Lite, or EMR with all the good stuff left in. And Mark and Bob, I hope you like this shirt.
This is Robert Gleeman with EMR Update. I'm talking today on our new program, Casual Friday. As you can see, I'm talking with Mark Anderson from the AC Group. Mark, are you casual?
Yeah, definitely casual day here. It's a beautiful sunny day in Texas.
You don't have a tie under there, do you?
No tie. This is just a typical T-shirt for playing with the horses. So.
Well, it is Friday, and we are. Yes, that's right. I know that you have horses, and you're a rancher guy. We wanted to talk about a thing called EMR Lite. Now, are we spelling this L-I-T-E or L-I-G-H-T?
I'm spelling it L-I-T-E, kind of like the beer commercials. Less filling. All the good kind of stuff that kind of comes from that. There really is no real definition of it, but I like the L-I-T-E type of wording because people kind of relate to it better.
And is that how you see EMR Lite, just the good stuff?
Well, we kind of define EMR Lite as the basic information that is collected by maybe the patient through filling out information, the information the nurse picks up from vital signs, history of present illness, family conditions, things like that, medications that they're on, maybe lab results. It's everything up to the point where the doctor actually goes in and does their physical exam and the note. So an EMR Lite includes all the technology, all of the documentation, except for that part that the doctor's doing today.
Okay. And what would be the advantage of a product with a Lite designation over the regular product? Price?
Well, ideally it would be price because you don't need as much sophistication. You don't need clinical decision support. You don't need all those other kind of things. And then the actual charting templates. The real difference is the ease of use. You're talking about a simpler product that can be used for scanning in documents, for the nurses putting in the vital signs information about the patient. Everything up to the point of the doctor actually doing their full physical exam and their assessment. And we think it does include, though, e-prescribing within there. So the doctors can still do their e-prescribing, maybe even do lab orders, but that can be all done on one page versus going through and spending 5 or 10 minutes clicking 100 buttons so they get the actual note generated. It does not do E&M coding because they're not actually doing the note, but it does everything that the nurse or the MA would do as far as social history, medical history, family history, vital signs, what medications are on, what allergies they have, what health maintenance alerts they may be behind on. So it's office staff and clinician use outside of the actual physician.
Well, Mark Anderson, I'm going to put you on the spot, something I never do, as you know. I always give you warning. Name an EMR Lite product, if you can, something that we might know of.
Well, I think if you look at companies like Allscripts, you can buy 5 or 6 of their modules, and it becomes an EMR Lite product. There's other vendors that, the typical vendors, the EMDs, the NextGens, the eClinicalWorks, the MySys, you can actually only implement up to that point. And I have a lot of practices that have done that. They haven't gone to the actual note recording, but they bought the full EMR, and they're only using it up to the point of the doctor doing their clinical charting. But if you go back and look at a company a couple of years ago called AIC Solutions, they were basically a document imaging company. They added e-prescribing, and then they had ways of recording vital signs and other kind of things. They were able to get lab results coming in as scanned-in documents, and, of course, that company ended up being bought by Allscripts. So there's a number of companies out there. There's another one out of Austin called Practice IT, which maybe somebody you can talk to, too. I think you interviewed him at one time. They have kind of an EMR Lite product.
That's
but
Rich
I think a lot of the
Steinle.
products.
I believe Rich
Yes.
Steinle is the CEO I did interview, and they recently have become a valued sponsor of EMR Update.
Oh,
so
good. That's
hopefully
nice,
we'll hear more from
Might
them.
be something good for-
Thanks for mentioning their name.
Well, it might be somebody to also do a follow-up interview with relating to this, because they understood that interest, that there are a number of doctors. In the survey that we just finished doing, we found about 47% of the doctors out there are saying, yes, we want to have certain things documented. We'd like to get rid of our chart, but we don't want to do the full documentation. 47% of the doctors have said, we want an EMR Lite product. And the hard part's been finding vendors that'll sell you just that part of it. They want to sell the whole thing. And again, 47% of the doctors have said they're not ready for the full thing today.
So maybe in the case of EMR Lite, the idea of modules comes into play where you can have a light product, and if you add more modules, now you have the heavy product.
Correct. If you look at how Allscripts, TouchWorks, and the Healthmatics product are sold today, they're sold as modules. You can buy 1, 2, 3, or 4 modules. I think that is a good way, because it's the incremental approach towards moving towards the EMR. And then, say a year after or 6 months after using the EMR Lite, you decide that we're now ready for physician documentation. You add one more module on, and then you have that full part. Now, some vendors only do just the document imaging, so they're one type of it. But I think we need some EMR Lite vendors, and then some vendors that could, have a product that's so modular you can add on, especially within community settings, like these hospitals are trying to roll out, and the Rios and Leo type systems. You're going to have a certain, maybe 20% of the doctors want a full EMR Lite. I mean, a full EHR type product. Some may only want a product without the health maintenance and stuff. But certain doctors just want access to information about the patient, like the emergency room. They need an EMR Lite so they can see what's going on about the patient, what's happening throughout the community, but they're not necessarily going to use it for total documentation, especially in a trauma setting. But they like to have a summary document about the patient. Again, that's an EMR Lite type product.
If one of our readers gives you a call, will you tell them this is a Lite product or not a Lite product?
I think we can easily do that by looking at what the products actually do. And you also look at some of the vendors like Axolotl and Health Vision and WellLogic and Orion. Those are companies that are trying to sell more community-based products. Those are kind of like EMR Lites.
Okay.
They're not trying to be a full EHR like the Allscripts, the NextGens, EMDs, MediNotes, and eClinicalWorks, but they're trying to provide something that can tie things together. As long as you're following some kind of standard protocol that everybody's supposed to be following in the future, these EMR Lites will be able to talk to each other, and I think it's a great value out there for those doctors that are not ready to leap into the full EMR or EHR products.
Well, I want to thank you for being with me on Casual Friday on zero notice. We did this off the cuff.
Yep.
And please, if you have any questions for Mark Anderson of the AC Group, his cell phone number is 1-281-413-5572. Is that correct, Mark?
That is correct, yep.
And thank you once again.
Cell phone.
Well, thank you once again, and have a great weekend.
All right, thanks a lot. Bye-bye.
Bye-bye.